Good evening, and thanks for joining us from all across Texas. I'm Will Dupree here in Austin. Right now, I'm joined by our Texas statewide reporter, Wes Rappaport. He's joining me here in our studio. And before we start talking about this town hall that's going to start here in just a few minutes with Governor Greg Abbott and some other state leaders, we want to talk about some actions that he took today. First, though, we want to say that Texas has issued its first public health disaster since 1901. And Wes, you were getting some information about why that was back then. So let's first start off with that context. Again, first public health disaster for COVID-19. That's the first time it's happened since 1901. What was that situation back then?
Yeah, I just got some confirmation from the Texas Department of State Health Services, who tells me that it was a smallpox outbreak in the early 1900s that forced that public health disaster. So this coronavirus outbreak now reaching the level of severity that smallpox outbreak had in the early 1900s, leading the health commissioner, John Hellerstedt, to issue that public health disaster for the first time since then.
We also want to get some information out there about this new executive order that the governor has signed. It goes into effect at midnight tomorrow. And again, Wes, you had confirmed that information in particular. But let's go through what some of this executive order will affect for everyone here across Texas. Take a look. There is at least 4 big changes that are supposed to happen in people's lives at this point, in case you haven't done enough yet to change what you've been doing to fight this particular virus. Let's take a look. Number 1, there are no public gatherings allowed of more than 10 people. That's across the entire state of Texas. That follows along with the CDC recommendation and that coming from the White House earlier this week. Number 2, it's the closure of all bars, restaurants, and gyms throughout the state. However, takeout and delivery service are still encouraged at this point. Number 3, there are no visitors supposed to go into any nursing homes or long-term care facilities. And then number 4, all schools must temporarily close. Wes, really quickly before this town hall gets underway here in just a few moments, what are we going to be expecting here?
Yeah, we are going to see the governor answer questions from the moderator, KXAN anchor Robert Hadlock, and as well as from Texans. We have solicited for folks to send in questions using the hashtag #AskAbbott. There's a whole list of questions that will be coming from viewers, from Texans. Also part of this panel discussion, the chief of the Texas Division of Emergency Management, NIM-KID, Dr. John Hellerstedt of the Texas Department of State Health Services, the Education Commissioner, Mike Morath, and a public health official also through DSHS, Stephanie Muth. So the conversation is expected to be wide-ranging, covering a lot of different topics. Of course, issues that matter to you and your family as we try and help put coronavirus in context.
We've gotten hundreds and thousands of responses, so we're going to try again to field through all of those and get those questions answered by these different officials. And I want to bring up our feed over here on my computer to see if we can bring that special report, this town hall, to you here in just a moment. Wes, you're going to have some participation in this coming up after that first hour of it. Is that correct?
Yeah, as soon as the televised portion is over, we will continue the conversation online. Texas House Speaker Dennis Bonnen will join us. I will go out on set and will join Robert and Chief NIM-KID to talk about, to keep the conversation going, to talk about, how this is impacting the state, to talk about what state lawmakers can do beyond just what the governor is doing. So there is still a lot more to talk about, and it does not end just because the hour of television ends. We're going to keep that conversation going online, and we will answer your questions. So in the feed that we have going, send us questions, and we will be thumbing through them and making sure that we ask Speaker Bonnen and Chief KID the questions that you have.
Once again, that was Wes Rappaport. He's our statewide reporter here for Texas, and we thank you all for watching. Here in just a moment, this town hall is going to begin with Governor Greg Abbott along with several other state leaders talking about what many of our conversations have been about for the last week and a half about this COVID-19 pandemic. And if you want to take a look very quickly before this gets started, we do have some information to share about the number of cases here in our particular area of Central Texas, 41 now in Travis County. But let's take a listen to this new town hall with Governor Greg Abbott.
Virtual Town Hall with Texas Governor Greg Abbott.
Good evening and thank you for joining us live from Austin. I'm Robert Hadlock from KXAN News in Austin, and I'll be your host tonight. Welcome to our virtual town hall meeting with Governor Greg Abbott. Governor, thank you for being here.
Thank you.
And your team of experts who are here with us tonight. These are uncertain times for all of us, and the governor and his team have dedicated the next hour to answer our questions and yours at home. We'll talk about the state response to the health crisis and what we can do to protect our families. The governor and his team have had their temperatures checked as they entered our station tonight, and we're also adhering to the 10-person rule and social distancing. Joining us here in the studio are 4 members of the governor's staff: Health and Human Services Commissioner Dr. John Hellerstedt, Texas Education Agency Commissioner Mike Morath, Nim Kidd, head of the Texas Division of Emergency Management, and Stephanie Muth, who is the state Medicaid director. Tonight's broadcast is being seen live and commercial-free in every Nexstar Media Group market in Texas, from Texarkana out to El Paso. In the few locations where we do not have a Nexstar station, we have shared this program with partners to make sure this information can be seen by as many Texans as possible. We have also provided access to all Texas media, a live stream of this broadcast for their websites. The program is also being broadcast on some Spanish language stations in Texas as well. Before we start with questions, the governor is going to take a few moments to update us on the very latest in Texas as we combat the coronavirus. Governor?
Thank you. Listen, first, I know that many of you are concerned, maybe scared, maybe confused. You deserve answers, and we appreciate Nexstar for providing this opportunity where we can begin to answer your questions. Second thing I want you to know is we're dealing with a very real challenge, a challenge that we collectively must respond to. Understand this, part of the confusion about this whole thing is we're dealing with an invisible danger. You know, often you can see a hurricane come in, or you can see a fire taking place, or you see a tornado, whatever the danger may be. You can often sense it with one of your senses. A communicable disease you can't really sense. And so it's important for you to be able to make sure that you listen to what we have to convey tonight so that you are going to be prepared to respond to this challenge. I want to make sure that you know that we are prepared to help you respond to this challenge. The first instance of COVID-19, which is the official name of the coronavirus disease, the first time a Texan contracted it was on March the 4th. Since then, we now have 5 deaths. To show how fast this can move, when I made a presentation at noon today, there were 3 deaths. Now there are 5. There have been 158 people in Texas who've tested positive. This time next week, there will be thousands of people who will have tested positive. In 2 weeks, probably tens of thousands. This is a very rapidly spreading disease, but it's one that we are prepared to respond to. We've been prepared beginning in January with these officials working with federal and local officials to make sure we are ready for this, and we were ready in January before it first hit Texas in March. What we're doing now is we're focusing on testing. We've already conducted thousands of tests, but we're prepared to do 15,000 to 20,000 per week. And in a conference with the president today, he let us know that pretty soon we will be able to do well over 10 million in a month. And so the tests are ramping up quickly, but the main thing we're focused on right now is really the only thing we can do to secure your safety and public health in the state of Texas. And that is to contain expansion and transmission of the disease. Working together, we'll get it done. 2 quick stories, then we'll get to the questions. 1. The first time that Texas dealt with the coronavirus was when the United States military flew people who were evacuated from a cruise ship into Lackland Air Force Base. There were 91 people. 1 was hospitalized because of the exposure to coronavirus. All 91 of them are now home with their families, safe and sound. That's a great result we want to see replicated all the time. Last point. We all remember what the state of Texas went through just a couple of years ago when we responded to Hurricane Harvey. You can remember what used to be roadways turned into riverways that nobody could escape. An entire region around Harris County was inundated. And yet, even though people were homebound for weeks, what we saw was the heroism of our fellow Texans stepping up and helping each other, taking rowboats or canoe boats or kayaks, whatever the case may be, helping out their fellow Texans, and together we made it through. Together we will make it through the coronavirus also.
Governor, thank you for that. Before we really get started with the questions, I'd like to ask you, have you been tested for the coronavirus?
I have, and very importantly, I wanted to make sure that knowing that since the coronavirus in Texas has been around the state for a month, and since that time I have shaken hands with or hugged or encountered thousands of Texans. I owed it to my staff, to the people of Texas, as I lead this effort to make sure that I was tested, and I tested negative, which means I don't have it.
And what about your team here?
I don't know.
I haven't had
Anyone
any
know?
symptoms.
No signs and symptoms. We're checking our fever every day.
Okay, good. Well, let's update our audience now on today's developments. In a news conference this afternoon from the Capitol, the governor announced an executive order. You emphasized it's not a shelter-in-place order. All critical infrastructure will stay open in Texas. Domestic travel stays open, and your executive order includes 4 steps statewide, and they take effect at midnight Friday through midnight April 3rd. First, avoiding social gatherings of more than 10 people, no eating at dine-in restaurants, bars, or food courts, and all gyms are closed. No visiting nursing homes, retirement centers, and long-term care facilities except to provide essential care. Finally, you ordered all schools to be temporarily closed, though you encourage online options to continue children's education. Let's break down each of those statewide actions and their impact so far. First, to clarify, you said all schools, that is private schools included, and all colleges and universities. Lots of questions tonight on Twitter about this. What can you clarify?
Yes to all of that. So
Okay.
this applies to any type of educational institution. For higher education institutions, the anticipation is there will be certain aspects of the higher education location that may be open. For example, food courts at a higher education institution may be available, or students who are relying upon dining operations at the university will be able to access that. There could be other services, there could be certain exceptions. Let me give you one example, and that is you have a laboratory at a university where they're undertaking some experiment. There could be a special exception granted in a unique situation like that. Here's the way this works. My office is working in collaboration with the presidents and chancellors of all the university systems in the state of Texas to work out what will and what may not be open. You need to be in communication with the person that you work with at your university or college so you can find out what you can and cannot do. But as far as all public schools and private schools below the college level, they are closed effective midnight tomorrow.
Mike Morath from the Texas Education Agency, is there any hope that we could open our public schools before the end of May?
So the order for closure lasts through April 3rd, and we're waiting and looking at the data as it comes in. We want to make sure that first and foremost we're making public health decisions based on the best science. How do we keep our students, our staff, and our communities safe? So I think we need to wait and see how the spread of the virus unfolds and what the data tells us as we get closer and closer to April 3rd before we determine whether a longer closure might be necessary.
Could you see it going into June and July, maybe in August to complete the spring semester?
Well, for most of our K through 12 schools, they're going to be finished by early June regardless, as the normal school schedule. So again, depending upon how we see the spread of the virus, we will adjust accordingly.
Governor, you waived the STAR testing requirements this week. Will students advance to the next grade without the state assessment tests?
Yes.
Yeah, the short answer is absolutely yes. So what we've done, with, subject to the governor's leadership on this issue, is ensure that our local school systems are empowered to make the best decision for our students. We want to ensure that our students are learning and they're progressing academically, and we want to make sure that we maintain high expectations for them. But the STAR has essentially been removed from consideration. So this is the judgment of local teachers and principals as to what's the best support for each student.
If I could just add, I mean, these are unique times that call for unique solutions, and we're going to be flexible in delivering solutions that work in our society.
So high school seniors can graduate without taking the STAR?
That's exactly right. Okay. The seniors who have not finished passing all of their STAR tests at this point have the opportunity to demonstrate academic proficiency in other ways, and as a result can graduate as long as they have met the academic standards of their local school district.
You encourage schools to find online options to teach students. How quickly should parents be able to see this in action?
It's going to vary from school system to school system. All of our school systems are rapidly standing up options to support their families at home. I should stress this involves both online and offline, sort of high-tech and low-tech. We have a number of families around the state that might not necessarily have direct internet access today, although I should say we have a lot of internet service providers that have stepped up and are providing free internet access to families. But even if you don't have access to internet, our school systems are equipped with low-tech solutions. Think of homework packets, the thing that you and I might have gotten when we were homesick, and regular check-in calls from the teacher to mom or the teacher to the student themselves.
We have a question from Twitter tonight. What about children who depend on school lunches? How will they eat during this time? This person is especially concerned for people who live in rural areas.
Absolutely. Well, our school systems have responded to this crisis with compassion and organizational excellence that we'd expect from Texans. So over 1,000 meal service sites have been stood up as of today in communities all over the state of Texas, so that students who were dependent upon their school for lunch and in some cases breakfast still have access to that in their communities. And in fact, we have announced as of today, about an hour ago, a website where every family in Texas can find out where the closest meal site is for their kids. That is texasschools.gov. Parents can get on there and you can see, you'll click on a link that says find a meal location. Parent can type in their home address and they will find that location. I should also say that we already have 1,000 school locations where people can access food, and the first school closure was less than 7 days ago. We expect a huge number of increased meal locations in the coming days as school districts respond to this challenge.
We have a question about children, of course, home from school during this period of time while parents still have to go to work. Will the state of Texas help finding solutions for child care?
Absolutely. One thing that we already are providing is making sure that the child care operations still maintain operations. They're not either required to close down. In fact, we are urging them to remain open, and we want to implement flexibility to make sure they're going to be able to stay open. We do want to make sure, however, that there are heightened standards at the child care locations, because we don't want COVID-19 to be brought into a child care location. And so we expect heightened standards with regard to where a parent will drop off a child, limitations on visitors inside a child care unit. However, because there are going to be so many children at home who otherwise would be in school, we want to make sure that we're not losing access to the nurses, the doctors, the healthcare providers that we need to help respond to COVID-19. As a result, we're going to be working to maybe create additional child care centers that will be in close proximity to where these people are working, so it's going to be easier for them to accommodate the shift in their lifestyle with their children being at home.
Ashley Inman on Facebook asking this question tonight: what's being done for people who will not be able to afford daycare? She says not everyone will be able to sit at home. Some people have to go to work.
Well, there's a lot of different strategies. It kind of depends upon a person's circumstances. Let me give you some examples, and that is there could be unemployment opportunities. There could be reimbursements that are going to be provided by some of these federal funded programs that are being created literally as we speak. Over the course of this week in Washington, D.C., but there are going to be multiple pathways to make sure that we're going to be able to accommodate the unique challenges that our fellow Texans are facing, so that people who have a job will be able to continue to go to work and have their child taken care of.
All right. I have another issue to talk about, another part of the executive order that you issued today, your ban on bars and eating inside restaurants. Just how will that be enforced?
Well, there's several ways it can be enforced. One is that whether it's a restaurant or bar, they have official authorized certificates from the state of Texas to operate. It's their license. And so there are enforcement authorities such as TABC, which has the authority to enforce bars compliance. And a bar could lose its license to serve alcoholic beverages if they violate this executive order. So literally their life as an ongoing business is on the line if they violate the order. And then in addition to that, law enforcement or with the executive order established by Commissioner Hellerstedt, he has the authority to go in and close down any of those organizations.
If people see this going on, people congregating in a restaurant, should they call 911 or what should happen?
Right now, if there's a large congregation of a group of people that exceeds the number that's talked about in the executive order, that's a potential health danger zone, and they should report it to us. We need to know about it because we as a state, really as a nation. So what I did today, I implemented the mandate that came from Washington, D.C. and CDC that mandated that we limit exposure to limit transmission of the coronavirus. And so anybody who is violating that standard is risking the health and safety of all of us. And we, as all fellow Texans, we must be all in this together to make sure that you are monitoring your peers and explaining to your peers they cannot congregate in groups of more than 10 people. Otherwise, they're posing a risk to you and your health and your parents and your grandparents. So we all work together.
The best way to report it, though? Call the health department?
Yeah, call the health department would be a quick solution.
Okay. Well, this may be a question for Dr. Hellerstedt. It comes from Twitter. Bobby French in Austin saying, you are still allowing all restaurants in Texas to offer drive-through pickup and delivery services, but not temporarily closing all restaurants in Texas. Aren't you giving Texans a false sense of food safety? Do we know, can the virus be spread in food?
If the restaurant is doing the sorts of things that it's supposed to do in terms of the standards of food preparation and handling, there should be no contamination of the food with a virus or any other germ to speak of. So we believe that it's about congregation, but it's also about distance and time. So when people are in their cars, they're not exposed to one another except for the other people in the car, and they're making an order, they're driving up to window, the transaction is very fast, the food should be safe, and they're really not presenting a danger. We know that it's really important for people to have access to restaurant food, and so this is one of the best ways to do it, is to have that drive-through or take-out type of service.
Do you ever foresee a moment where we could ban drive-throughs and takeouts?
Well, we always have options in the future. We try and make sure that our activities and our actions and our recommendations are in sync with what's really happening with the situation as we see it. So the situation as we see it right now doesn't call for that. But one of the things we need to remember that it is all of our responsibility to do everything we can to keep from getting infected, to help our neighbors and our co-workers to keep from getting infected. That is what is going to drastically reduce the spread of COVID-19 in Texas.
And today we saw the Texas Restaurant Association calling for the state to defer all sales taxes for the restaurant and bar industry. Will you consider that, Governor?
We'll consider anything as we work our way through this process.
Okay. Again, these actions in place for at least 2 weeks now. What needs to happen before life begins to return to normal and Texas rolls back some of these approaches? How long before we get back to normal is the question.
Well, again, it depends on how long the coronavirus poses a problem for us. Our hope, if we do our job and we are able to contain this and bend the curve of the growth of the coronavirus, then we'll be able to get back to normal. So physically, you will be able to see where we are when you start watching the bend of the curve of the growth of the coronavirus in Texas. When it starts bending, we're getting real close to getting back to normal.
Dr. Hellerstedt, we were talking earlier off camera, that may take a while.
That's correct. So the thing we want to avoid is a very sudden, steep increase in the number of people who get sick, because a certain percentage of people who get coronavirus do get sick enough, for instance, to be in the hospital. And we want to slow that rate of growth down so that everybody who needs to have hospital care will have a bed available to do that. And that means, frankly, trading a short period of time where the virus might run its own course and stretching it out over a longer period of time where we have the capability to cope with it the way we normally would.
Governor, would we see the economy just frozen for several months like it is right now?
Listen, this is going to be a tough economic time, but not just in Texas. You see it across not just the entire nation, but across the entire world right now. The only thing that would be tougher is if we do not take this action right now and we turn into a situation like Italy. That would be the worst case scenario. We want to prevent that from happening.
We have a Twitter question now from Luis Gonzalez, who lives in Austin. He asks, do you agree with the initial federal response to the coronavirus? Was it good enough?
Well, here, I mean, the initial federal response was to stop travel from China. And obviously that was the hot zone where it all began, and so stopping travel from China was very important. Since then, we've been working very aggressively with federal leaders, whether it be the president, the vice president, his cabinet, his staff, Dr. Fauci, Dr. experts. They're all doing a fabulous job of advising us, but now providing us resources. We're getting so many resources for testing kits and the ability to make sure we're going to do a better job to contain this, whether it be in Texas or in other states.
How is Texas responding differently from the federal government?
Well, I mean, the state has a different role to play than the federal government. The federal government has the large, broad swath of healthcare advice through Health and Human Services and through CDC, and the states are more on the implementation side, alongside the local governments.
Kidd, how do you believe the state is responding to this at this point?
You know, we're not a stranger to disaster. We lead the nation in the number of presidential disaster declarations. We normally follow the local rule process with this. Our mayors in Texas and county judges are by state law the emergency management directors. They have experts, and when you look at the resources, the people that are closest to the problem, our local officials make those best choices. I think what we're seeing now is not just a local problem or a state problem or even a national problem, but the global problem. And that's why the governor's executive order today, I think, gives a level playing field for all of our mayors and judges to work from. We didn't take their authority away, we gave them a tighter box to be working within so we can all focus on the problem at the same time to achieve a better outcome and results.
Let's go to a different kind of business we rely on for our daily lives. It's getting haircuts, a simple thing we all need. This question coming from Amber, a KSAT 12 viewer in San Antonio via Twitter.
Governor Abbott, I am a hairstylist in San Antonio, Texas. I am self-employed and I rent a salon suite. What do we do as far as income? We're still expected to pay rent, and from as far as I know, we don't qualify for small business loans or unemployment.
Governor, what do you say to hardworking people like Amber?
Well, they fall into different categories. The type of business that she's involved in has not been shut down yet. And I don't know about her employer. I missed her employer status.
She works for herself in a salon.
Well, but if that's so, salons have not been shut down.
Okay.
So she should still be able to earn money. But importantly, to further answer the question, there are different ways that different people who are unemployed are going to be able to access benefits. There is unemployment insurance that's available, and very importantly, I waived certain rules and regulations that would drag out your ability to access that, so you would be able to access it more quickly. In addition to that, there are other different sources of benefits, such as small business loans that could be available. Not to that particular individual, but again, that particular individual should be able to continue her trade and practice.
All right. Bruce Forbes is a small business owner in Longview. He wants to know if small businesses must lay off their employees, will the owner be liable for unemployment chargebacks, and what about insurance hikes?
Well, he's asking about business decisions, about how best to run his business, and I'm going to have to leave it to him how to make those decisions. Let me just explain it this way, and that is, our goal, if we do our job, is to make sure that he's going to be up and running sooner and back fully employing these employees.
All right. Governor, we've had a lot of questions about applying for federal disaster loans from the SBA, the Small Business Administration. When will small businesses in Texas be able to apply?
Should be hopefully as early as tomorrow, at the latest I would think on Monday. So our application to obtain those loans from the federal government is in Washington, D.C. as we speak. We're just waiting for approval from the SBA administrator.
And tonight, though, we're getting reports that the SBA's website, they're not able to do that. You're saying tomorrow will be the day?
Yeah, so the reason why they're not able to do it is because as of this afternoon, I not yet received word from the SBA that they had approved the Texas application. I'm sure they have a bunch of applications on their desk, and that's why I say I would expect it tomorrow. I don't know if they'll be working this weekend. I hope they will, and hopefully at the latest they'll have it done by Monday.
Lots of moving parts, of course. Texas, of course, has been a leader in job creation around the nation for years, and now we're facing this unemployment crisis. Are you planning changes or expansions in unemployment benefits?
Listen, we need to be prepared for everything. I don't think there's anything that has to be put on the table. I don't think there's anything that must be taken off the table. We don't know if this is going to last 2 weeks or is it going to last 10 months. And because we're dealing with these uncertainties, I think we need to maintain flexibility in how we govern to make sure we will be able to take care of our fellow Texans.
Can you forecast an unemployment rate at its worst?
I can't forecast it because we simply don't know what's going to happen. We do know there is going to be a temporary downturn. Hopefully that downturn will be only a couple of weeks long.
The state, of course, has a rainy day fund. How much is in that right now tonight?
Well, we have billions of dollars in the rainy day fund. One thing that we were successful in doing is making sure that we had a lot of money in reserve in case something like this were to arise. And we will be able to assess the situation as we move forward. But in addition to that fund, there's also a disaster relief fund in the governor's office that I have access to be able to respond to these challenges.
How much is in that?
Well, there's $150 million in that,
Okay.
but there's multiple billions in the rainy day fund that we can tap into at the appropriate time. But the appropriate time will be when we know the full extent of the challenge that we're dealing with.
Is that your sole discretion, or do you have to get the legislature back?
On the rainy day fund, that requires the legislature to act.
And you could call a special session
Sure.
and, to get that done. Oh, tonight, yes, sir.
Sure, go
I'd
ahead.
like to add on to that as well. The President's Emergency Disaster Declaration makes money available immediately to local governments also for the response cost of this. So while the Governor's Contingency Fund allows us to start operating and local governments can spend their money, this Presidential Disaster Declaration, where we will work with all cities and counties and certain private nonprofits to receive reimbursements up to 75 cents on the dollar for all of the expenses they have. It's very important that they know that we have our website set up and they should be submitting those costs to us. They should be tracking those costs and keeping all of their receipts. That will help us turn that money around a lot faster and help us with our cash flow problems.
Keep the receipts, okay. Tonight, the price of West Texas Intermediate crude is just under $26 a barrel. That's about half of what it was a year ago. And since we're statewide tonight, let's address a question we've been getting a lot from West Texas especially. There's fear about job loss in the oil and gas industry tonight. What can the state do in terms of subsidies or other proactive steps?
Well, first, let's remember something, and that is where the price of barrel is right now is exactly where it was in 2016. These go up and down, and so if the state were to react, every time the price of oil went down, we'd be reacting every other year pretty much. And so we need to understand that the oil sector aside, there are many sectors of our economy that are completely obliterated right now. Look at the restaurant industry, for example, or the entertainment industry, movie theaters, et cetera. So we have many sectors of our economy that are suffering mightily. That's one reason why you're seeing in Washington, D.C., all these different legislative efforts to try to respond to those challenges. That's why also the state of Texas, we will be able to begin to address this legislatively at the appropriate time when we know more about the contours of the size and magnitude of the disaster.
Turning to retail and the demands we're seeing at all the stores now, grocery stores and pharmacies are open right now virtually everywhere. Can you ensure the state will keep them open during this crisis?
Listen, I've been in constant contact with all the large retailers in the state of Texas, and they are stocked and ready to go. I know that people go to the store every single day, and I see stories every single day about people going in to get whatever they want to get and they're not being there. But I also know that I've talked to that particular store chain, and I know they have it in their inventory. They are restocking every single night. Some are making these accommodations that are great accommodations to allow seniors to go in for the first hour, then everybody else after that. But these stores have both the flexibility but also the supply chain to make sure they're going to be able to weather this challenge.
You don't have a fear of disruption of that chain?
Since I've been able to speak with these chains, I feel very confident about their supply chains.
Okay. We've been checking, well, last Friday you told Texans there's absolutely no need to stockpile, but we're seeing the empty shelves. And we've gone through that question. We need to keep going here with another one. This one about the Texas Attorney General's office. We've been checking in with them. The latest number we have is that nearly 1,000 complaints have been received now about price gouging in Texas. What is the AG's Consumer Protection Division doing about that?
Well, they take these complaints and then they will prosecute anyone involved in price gouging. What happens is when the governor makes a disaster declaration that authorizes the Attorney General to pursue a legal claim against anybody who will substantially increase prices just because of the crush of demand caused by an emergency situation. So a retailer that normally sells, let's say, a bottle of water for $1 can't suddenly start charging $10 for that just because there's a rush of people coming in because of a gubernatorial declared disaster. And the Attorney General has been very aggressive about prosecuting people for doing that, like in the aftermath of Hurricane Harvey, and he will in this instance also.
Are you aware of any scams on the internet or elsewhere going on?
Yes, and so there's unfortunately along with situations like this, there are scams that arise, especially scams related to people seeking donations from you. And when people are seeking donations from you, you need to check out what organization that is, if they're valid, because people are out there trying to scam you out of your money. Make sure if you're donating money, you know that it's a valid organization to donate to.
Good advice. So let's address testing for COVID-19. In a news conference on Monday, you said everyone needs a COVID-19 test. We'll be able to get one by Friday. Tomorrow, of course, is Friday. Is that still the case?
Yeah, but here's the deal that people need to understand. There's a difference between everyone who wants a COVID test and everyone who needs a COVID test. And I'll let the doctor answer more about this, but I'll tell you my explanation having listened to this and other doctors, and that is the only people who need a COVID test are those who are showing signs or symptoms of having COVID-19. And there's no reason to give that test to those who are otherwise healthy. There is a singular reason why we want to test people, and that's so we can identify who has COVID-19 and isolate them so they don't communicate that disease to somebody else. We will be successful only by limiting that communication. That's the purpose of doing the test. There's no healthcare benefit to having the test run because there is no medication or medical treatment for the person who has COVID-19. But I'll defer to the doctor on all this.
Yeah, doctor, how do you determine that someone needs this test?
Absolutely. Well, as the governor said, it is really a combination of symptoms and, if you will, risk factors that need to be present. So symptomatology, what we call influenza-like illness. So it really looks like the flu. You've got that cough, fever, cold symptoms, aching, all that sort of thing. And then do you have a risk factor? So one of the risk factors could be just being elderly and having underlying medical conditions. That should qualify people to get tested. Another would be contact with a known case of COVID-19, or the other could be travel from a region anywhere in the world, including now some places in the United States, where COVID-19 is undergoing, if you will, sustained community spread. And then the final category would be persons who are hospitalized with a very severe respiratory type illness, where the other diagnostic tests that have been done have failed to reveal a definitive diagnosis. So those are the situations in which we're using testing to its best effect.
We understand from Travis County, where we are tonight, that counties have to wait for approval from the state to perform each test. So we're told there's a bottleneck. Can you talk about that process?
Well, there's two ways to access testing, if you will. One is through the public health system, and we are using the very criteria that I just described to get that testing done. Really, the system's pretty efficient. People can call the local health department, the local health authority. They can have a discussion. If the person fits those criteria and we can get a sample from them, we can get them to any one of 10 public health labs around the state that are performing the tests. And the turnaround is really then once it gets to the lab, it's anywhere between 48 to at max 72 hours, because we do need to batch the tests together so that we're having the most efficient use of the testing that we have available. And again, as the governor said, the treatment for COVID-19 is supportive. So unlike some other diseases where you have a specific diagnosis and then you have a specific treatment, knowing precisely what that diagnosis is in a timely way is extremely important. Here, we don't have those specific treatments, and so we would provide that supportive care to somebody who's sick, whether they have COVID-19 or not.
How can you fix the bottleneck, though?
Well, one of the things we think is going to happen again is what the governor talked about, is that we'll have more testing sites around the country, that private laboratories will make available really, again, thousands of tests per week and maybe even more in a very short period of time. So we expect that to come online any day now.
If I could elaborate on that, especially in response to the way the question was asked. The question was asked about the capabilities of public health, and that's what Dr. Hellerstadt's in charge of. And there's the Public Health Authority, say in Travis County, that will provide it. Understand this, there are multiple other providers of these tests. You've seen in Austin, Texas, for example, and other communities, drive-through tests. Here it's done by a particular hospital chain. Other areas would be provided by somebody else. In addition to that, through federal funding, there are now step-up facilities that have been provided in major cities across the state of Texas, where those facilities alone have the capability of testing 15,000 per week. And that's in addition to all the other private providers. So public health is just one slice of the multiple entities that can provide the collection and the testing.
What is currently the treatment for the virus itself, doctor?
Again, as I said, it's supportive care. So in other words, if somebody's ill, for instance, one of the things we recommend is that they stay home. They don't need to seek health care or even a diagnosis necessarily unless they get sicker, unless they can't take care of themselves at home. If they get to the point where they can't take care of themselves at home and need, for instance, supplemental oxygen or other types of treatments in order to maintain their bodily functions, that's the time that they're going to go to the hospital and get that supportive care. So by supportive care, that's in contrast to, say, something like influenza, for example, which in many cases we actually have very effective antiviral type drugs that can be given that really essentially shut off the reproduction of the virus. We don't have that yet in the case of COVID-19. And so what we have, again, is those supportive measures.
If you're a Texan sitting at home tonight watching this and you think you have the symptoms, what should you tell that person? What should they do?
Well,
Go ahead, sure.
really, again, if somebody has it, they should think about, was I exposed to someone that I know has it, for example. Otherwise, if they don't have those risk factors that I mentioned earlier, they should, if they can, stay at home and recover and recuperate.
Okay. Could I add this? Because sure. This is very important. This is what we've talked about a whole lot. If you think you may have COVID-19, the last thing that you should do is to go to the emergency room or to go to your doctor's office. Because if you really do have it, you're exposing others to it. If you think you have it, you should call your doctor and visit with your doctor about what the correct approach is.
Is the COVID test free?
The COVID test is going to be provided for free to anybody who qualifies for it. The qualifier is a prescription by a doctor.
Okay. In Colorado, their state health department continues reporting a daily health update, and that includes how many tests have been requested and how many have come back both negative and positive. Is Texas tracking those numbers, and will you release them?
We are doing our best to track those numbers. As far as the number of tests that are being done, right now, as the private labs are coming on board, that compiling all of that information in one place is something that we are working on.
If I could add to that, today there was a press conference with the medical team working with the president where they talked about this very issue. They stressed the importance of aggregating all this information from all these private providers of these tests and other information and make sure that it's compiled and publicly available. So that finally will come to an organized way so that it can be provided to the public.
Okay. This might be a good question for Stephanie Muth, the state Medicaid director. The state has the highest number of uninsured people in the country and has consistently declined to expand Medicaid. Potentially, this crisis will hit the uninsured the hardest. Does this give you reason to reconsider the state's position on Medicaid? That's probably a good question for you, Governor, but let me get your perspective.
Yes,
Stephanie.
Robert, thank you. I think it's really important to remember here that what we're dealing with is a public health crisis, and access to insurance is not going to resolve the immediate issue that we need to focus on. As we've all heard in the discussion tonight, the immediate issue before us is how do we prevent the spread of the virus? And that is through following the governor's executive order, listening to the advice of our public health professionals like Dr. Hellerstadt. And in the Medicaid program today, we cover 15% of Texans through Medicaid. And some of the things that we're doing in Medicaid to help protect the health and safety of those individuals, again, we were talking about if you're sick and you think you have the COVID virus, we don't want you to go into a doctor's office or an emergency room. Texas Medicaid has one of the most expansive uses of telemedicine compared to any other state in the country, and we're also adding telephonic consults as an option. So we're working diligently to protect the health and safety of those individuals that are on Medicaid.
Has this incident caused you to reconsider your stance on Medicaid expansion?
No, because the response here is one where we want to make sure, regardless of whether or not you're on Medicaid, regardless of whether or not you have access to health care insurance, you are going to be able to see if you have COVID-19, you're going to be able to go get tested for it and get treatment for it.
Okay. Well, healthcare providers are perhaps most at risk of getting COVID-19. Listen to this question from Savannah Hernsberger from Hallsville in Harrison County.
Currently, it's only been recommended that dental offices limit dental services to emergencies. We're also being asked by suppliers and employers to wear the same mask throughout the day and to limit the amount of gloves we use per patient. In order to protect patients and staff from cross-contamination and to preserve supplies for medical teams, will there be any mandates for dental offices to close?
So two sides, will the state be shutting down healthcare providers like dentists?
Yeah, there is no intent right now to shut down any healthcare provider. It would be up to her employer, that particular healthcare provider, to make sure that they are living up to the standards of care of that particular health profession.
And what's the state doing to keep healthcare providers the supplies that they need to stay open?
Yeah, it's something we constantly work on.
Yeah.
Obviously with a keener focus, if you would, on the healthcare issues related to COVID-19. But one thing that we do every single day, sometimes all day long, is work on the supply chain.
Dr. Hellerstedt, do we have enough masks?
That's absolutely true. We are going, leaving no stone unturned to find all of the protective equipment that we can, and we are making steps to distribute what we have to the most critically needed circumstances. We can't wait for the day when the supply chain comes back to its normal, robust levels, but that's not here yet.
In a presidential press conference this week, it was announced about several organizations that are stepping up that are manufacturing tens of millions of masks to be used.
Just a matter of waiting for it to get here.
But it's happening very rapidly, though.
Okay. Looking back at disasters like Hurricane Harvey, some Texans are struggling with and still coping with mental health issues. Any plans for mental health resources at the state level?
Robert, I'll take that
Okay.
question. We have our local mental health authorities that are located across the state, and they are providing, this is a very anxiety producing time for some individuals, and mental health services are incredibly important. People can find their local mental health authority by calling 211 and locating the closest mental health authority to them. And in addition, we've been working with those mental health authorities, so when they're serving individuals who are on Medicaid, again, those tools that we talked about, the telephonic access to services, using telemedicine where it's appropriate, will be available so they can easily reach people without having to come to them.
What's being done to help medical professionals who are really getting it right now, just overworked and stressed out, really, a lot of them?
I would like to say something about that in general. One of our concerns that we want to make sure that we're vigilant about as a state is to do all we can to protect the health and safety of our healthcare workers. They're on the front lines of dealing with COVID-19. So we are extra vigilant in making sure they're being tested and evaluated and doing everything we can to prevent them from getting COVID-19. If we lose our healthcare workers, we're going to lose our ability to respond to this disease the way we need to.
Indeed. Well, with the cases expected to spike in the coming weeks, rural areas in Texas may be hard-pressed to handle all of their healthcare needs. The state of Texas has had 17 rural hospitals shut down in the past decade, Governor. Are there any plans to reopen any of these facilities?
We're going to look at absolutely all options and do whatever is both necessary and that we're capable of doing to make sure that anybody who's going to need access to health care to respond to COVID-19 will be able to get the response they need.
You spoke in your news conference today at the Capitol about possibly using hotels. What would they be used for?
Well, one thing that I did this past week is I visited with the CEOs of all the major hospital groups in the state of Texas to do basically an inventory check. How many beds do they have? What is their bed capacity? What is their excess capacity? And then what are their alternatives if they get filled up? The first alternative was medical tents. The second alternative were recently departed healthcare facilities or hospitals, of which there are an abundance of around the state of Texas. But then down the chain were hotel rooms. Hotel rooms, we've had plenty offered to the state already. that we could use, because no one's going to a hotel anymore, so there's a lot of vacant hotels. And they would be used for the type of situation that Dr. Hadlock was talking about. If somebody who's been identified positive of having COVID-19, but they don't have extreme health-based issues. They need a place where they can isolate for 2 weeks in their own room with access to a bathroom, and that would allow them to convalesce and then re-enter wherever they were living before that. We want to make sure we have facilities like that across the entire state of Texas.
And that would be a low-cost solution to
a
big problem. Governor, our company, Nexstar, has made a priority covering real-life issues along our Texas border. You may already know this, but we have dedicated an entire website to that content called borderreport.com. Our Border Report correspondent, Sandra Sanchez, has this question from Barr in Hidalgo County.
Many South Texans living here have told me they have concerns that international bridges between Texas and Mexico will be shut down. If so, that would close trans-border commerce as well as prevent people from visiting relatives across the Rio Grande. Governor, have you asked President Trump if he's considering taking this step? If so, how do you address these concerns that Texans have?
Sure, and here's the facts that understand them.
Okay.
And that is, if you recall earlier this week, the President announced an agreement with the Prime Minister of Canada about closing the border between the U.S. and Canada for non-essential, non-commercial activity, still allowing commercial activity to take place. It's my understanding that there may be an announcement tomorrow by the President involving Mexico. If not tomorrow, it may be coming soon, probably articulating the similar standard, and that is doing the best to close the border for purposes of cross-border traffic of people who could be bringing COVID-19 into the United States. It would be doing what we're doing here in Texas already, but still allowing commercial traffic to continue.
How would you stop the flow of people just coming across the river in rafts and whatnot?
The same way that's done every single day.
And Nim, any thoughts on protecting the border?
I think the governor said it very well.
Okay. For more on our border issues, you can go to borderreport.com. The Texas National Guard has been activated but not deployed. Can you confirm that? What's the status of that
Yes,
issue today?
I can confirm because it's the governor who activates them.
Right.
And so I've been working with the general of the Texas National Guard since early February to make sure that we are on the same page plan-wise about exactly what we would do. And they are prepared to respond to different types of situations. Right now, we typically respond to requests for support, and that would be if there needs to be, let's say, a sudden pop-up of a medical facility. You could have the National Guard go in there and prop that up in one day, basically.
Okay. Here's a question from Twitter from Arthur Gonzalez here in Austin. What are the rules for funeral services? Are those on hold, or are funerals exempt from the 10-person rule?
Well, yeah, I'm going to try to recall what the CDC standards articulate, and we would urge the same. Let me convey this, and that is obviously anybody who loses a loved one, they need to be able to celebrate that life in the way that is most meaningful to them, and we want to be able to accommodate that. The best practice would be this, and that is try as best as you can to limit it to no more than 10 people. We understand you lose someone for life, and it may be impossible to do that. Let's say you cannot limit it to 10 people. Try separation practices so that you remain separated enough so that people will not be contagious to somebody else. I will tell you, it's my understanding from the CDC standard, and that is they are encouraging funeral homes to do this through online video as an accommodation.
Difficult situation.
It is a difficult situation, but we have imposed no particular restrictions on funerals.
All right. What about church services? People love going to church, a lot of us. Any implications here for weddings? It's wedding season.
Right. And another sad situation, I know a lot of people who've had to cancel weddings because of this, but there was nothing specific in the executive order about churches because there's freedom of religion here in the United States of America. But what we find almost all churches are doing, and that is the churches obviously care about the health of the people who go to their church, and they care about safety standards and societal standards. And so what we're finding most churches do, and that is to provide online services, alternative services or seating situations that ensure they're not endangering anybody else there. Remember this, we really have one simple goal, and that's to make sure you are not going to communicate a disease to somebody else. The way to achieve that goal is to maintaining your distance from somebody else.
The primary runoff election set for the end of May. Do you support postponing that vote?
So the parties are working on this as we speak and working on an agreement, and we may be making a decision as early as tomorrow out of the governor's office about what our advice is.
Any plans for a special session?
Listen, every option always remains on the table. We will continue to work our way through this. If everybody does their job and we get through this and it's done in 2 weeks, there's no need for a special session. So everyone, do your job.
We have a lot of folks in jail across Texas, everybody in tight quarters there. What's being done to protect them and their staff?
This is a top concern because you mentioned the two categories. There are the inmates and then there's the staff there. So we're working on protecting both and working for different options depending upon what happens. We obviously want to make sure that the inmates don't contract COVID-19 because if they did, it could move very quickly throughout a jail. And then in addition to that, we want to make sure that the staff doesn't contract it. And it should be, so one thing we have done is to make sure that there are no visitors to jails. So we don't want anybody importing COVID-19 to the jails. So only staff and the prisoners can be in jails. But we have strategies in the event that an inmate contracts it. We have strategies in the event that an employee contracts it. Let me be very, very clear to all employers of people who operate in jails. If you believe that one of your staff has contracted COVID-19, they need to be isolated and not exposed to anybody else at the jail. And I would recommend everybody that person came into contact with who works at the jail be tested.
So could we conceivably let people out of jail early just to relieve some of the pressure in the
It's not my recommendation.
Okay. What would you do?
Oh, there are isolation strategies where you could isolate those who are in jail who do have COVID-19. You could provide special cells for them in the same type of condition, just where they are unable to communicate that COVID-19 disease to anybody else. The same, if you would, type of holding strategy that we are using for people who are not in jail.
Governor, this is a very costly crisis for the state, a lot of money being spent. Could you foresee raising taxes in some way, sales taxes or other forms of taxation?
No.
To just try to deal with it in the budget process?
No, I mean, we have been responsible in the budget process in ensuring that we have billions of dollars in the rainy day fund to respond to it. But remember this, it's not as if Texas is an isolated entity dealing with the multitude of financial challenges here. As Nim Kidd pointed out very accurately earlier, this is now, among other things, a FEMA-based response, and there's a lot of federal funds that are flowing to help us respond to this through FEMA. In addition to that, there are all these other federal programs. And so I would say right now, money is not the problem, it's public health safety. And if everyone does their job from a public health safety standpoint, there won't be a money problem in the end.
Okay. Governor, you are around folks all day long and traveling frequently lately between Texas cities. Have you personally altered any of your routines to try to stay safe from this?
A lot of them, and it's hard for a person who's a politician, the governor of Texas. I have an impulse to shake someone's hand or to give them a hug, and so I've had to reduce my physical engagement, but also reduce the number of places that I go to. So I'm doing my part, just like I'm expecting everybody else to do their part, to make sure that we are reducing our exposure, and that's the best thing we can do right now, to make sure I'm not putting myself and you're not putting yourself in a position where you could contract COVID-19.
Dr. Ellis, really quickly, we've been hearing, don't know if it's an urban myth or not, that the warmer weather helps to reduce the chances of getting this virus. Any truth in that? We're getting warmer now this time of year.
I certainly wouldn't rely on that happening. And one of the examples that we have in the past was the 2009 H1N1 influenza virus. It actually occurred off-season, so it wasn't during the winter months, it was in the spring and the summer months. So when you get a brand new novel virus like this, and by the way, by novel, what we mean is that there's no human population that has pre-existing immunity to it, and that's what's most dangerous. It can spread very quickly. And so I wouldn't necessarily rely on the fact that summer, warmer weather is really going to curtail this.
Governor, public transportation, many millions of Texans rely on it, buses and trains and whatnot. What about restricting travel on that just to protect people from the virus?
Well, it may come to that, but not yet. The standard is that all of these public transit organizations, they need to do a comprehensive job of wiping down and cleaning out and making sure that they are not exposing any passenger to anybody who may have traveled on that particular mode of transportation to any type of bacteria or germs that could lead to contracting COVID-19.
Well, in many families, college-age children are back at home. They're at a very social age. Your daughter Audrey is home from college, we're told, and any counsel you provided her in this difficult time for all of us?
Isolate. Seriously, you can have fun in so many ways, but you need to limit the number of people you come into contact with, because I told my daughter this: you don't know if the person that you're talking to right now does or does not have COVID-19, and equally important, you don't know if that person just had a conversation with somebody else who has COVID-19, because we're dealing with a silent killer out there, and because you don't know, you need to protect yourself by limiting the amount of public interaction you have for a few weeks.
Quickly, Doctor, we saw a video of kids partying on South Padre. Bad idea, right?
Again, you don't want to be too close for too long. It's a risk.
Okay, if I can be clear, it's a prohibited idea right now.
We got about 20 seconds. You wanted to sum up.
Your public health and safety is at risk. We need your collaboration and cooperation to make sure we contain the spread of COVID-19. If we do this for just the next few weeks, we will be able to make sure we get this whole challenge behind us. Working together, we're going to keep Texas the best state in the United States.
We are out of time for this statewide television broadcast. However, we invite you to continue with us for another half hour. We'll keep talking with state officials on our live stream with many more questions like what about going to church, etc. Look to the local Nexstar station in your area, or simply go to kxan.com. Right now, Governor, thank you, and we appreciate you all coming in. Stay strong, Texas. Good night from Austin.
Will Dupree once again here in Austin. You can stay with us for just a few more moments before the conversation continues after this virtual town hall with Governor Greg Abbott and several other cabinet members within his administration. I think the first thing to maybe say is first that he had said that he himself, the governor, was tested for COVID-19 and those results came back negative. His other cabinet members, the other 4 people who were in the room there, said they are still monitoring for their symptoms at the moment, but they have not been tested, and so that might change in the future. As you can see, there is a slate that's come up on the screen right now. We are awaiting this conversation to begin once again here on our streaming platform, so we do appreciate you all sticking with us here on the Nexstar station in your area. But once again, we are broadcasting live here in Austin, Texas. I want to say that before this town hall continues here in just a moment, the governor issued a new executive order earlier today that will go into effect tomorrow at midnight and will last through April 3rd. If you take a look, these are the actions that will be taken. Number 1, there are no public gatherings allowed of more than 10 people. The governor said during his town hall just a few moments ago that people should report any kinds of gatherings that are more than 10. And you can call your health department. That was the governor's recommendation. Number 2, all bars, restaurants, and gyms are closed at this time. That affects the entire state of Texas. However, takeout services and deliveries are still encouraged so that businesses can still get some of that revenue. Number 3 there, as you see, no visitors are allowed at nursing homes, senior care facilities, or long-term care facilities. That's because those people in those areas are most vulnerable, it appears, according to medical experts, that COVID-19 could affect them the worst. And then finally, all schools must temporarily close. Many of the districts across our entire state are now preparing for potentially online instruction for students so that learning can still continue. So we will have to monitor for that and pass that along as soon as we find out what kinds of things districts will be doing, since all schools are right now temporarily closed. If you take a look at this graphic here, these are the latest numbers that we have confirmed about the coronavirus outbreak here in Texas. There are now 308 confirmed cases across the state, 5 deaths as of this evening, and that includes Matagorda, Collin, Tarrant, Harris, and Dallas counties. And according to the Texas State Department of Health Services, more than 2,300 people have now been tested for COVID-19. Those numbers should change, though, as more test results come online and more people seek that service. Once again, you're joining us here as we are awaiting the conversation to continue with our virtual town hall. The governor was just speaking, as well as the commissioner of the State Department of Health Services, Dr. John Hellerstedt, the chief NIM Kid of the Texas Division of Emergency Management, Stephanie Muth, the Medicaid Executive Commissioner, and Mike Morath, the Texas Education Agency Commissioner. And it appears our town hall has now started, so let's take a listen once again as that conversation continues.
Joining me now is KXAN's Wes Rappaport. Welcome aboard, Wes.
Thank you.
At this half hour, we have Nim Kidd, head of the Texas Division of Emergency Management, and Texas House Speaker Dennis Bonnen. Gentlemen, welcome. Speaker Bonnen, can you break down your role in the background of all this as the state is coping with this?
To stay in the background. But the role is to really be as supportive to our agencies and follow the lead of the governor and speak with the governor and discuss some of the issues we're facing, and then show a united front and show Texans that the leadership of Texas is working together. We are in agreement on the tough decisions that are having to be made, and then delivering the message to Texans that we're going to get through this together. We're having to do things that they're difficult, they're different. Some of them are difficult because we've never had to do them. They're not that hard. They're just very unusual to be asked to keep this social distancing and do these. I don't know about y'all, I'd never heard the term social distancing before.
Neither, right.
COVID-19 showed up on the radar.
Yeah,
So
right.
Our role is to be supportive and help the members, the Texas House members, push out the information to their constituents and understand those issues. An example would be like with the STAR test. We were very involved over the weekend working with the Education Agency, TA, and one of the real issues there, the role we have to play is letting our constituents know what is important to be concerned about and what challenges they need to resolve and how we can help them, and what maybe isn't as important. So the governor showed great leadership saying we're not doing the STAR test this year when he did that Monday morning, because Texans weren't focusing on what was most important at that moment. What was most important was, what do I do with these kids that are now going to be home? And I'm going to have to be a part of their education moving forward. How do I make sure I can juggle my job and helping my kids learn? But they were worrying about a test that wouldn't even be given for a month. So the governor showed immense leadership and said, I'm going to remove that concern, because that's an anxiety I don't want Texans families facing, along with the other issues that they need to truly be focused on to make this a successful response.
He's getting a lot of praise for that move.
As he should.
Nim Kidd, anything you want to expand on from the broadcast?
You know, I think one of the things that we really need to remember is the first responders that are out there in the field every day. We're still responding to the normal 911 calls that we see all across this state. Severe weather last night in the North Texas area, a couple of tornadoes, homes damaged, a couple of injuries. So the extra stress added onto the first responders is real, and it is there. Our healthcare systems are the absolute #1 priority to maintain them. Our critical infrastructure and key resource operators, we've got to keep them healthy. And from the supply chain side, you heard the governor talk about this, it's not about the stuff that's in the warehouse. It's the panic buying that we see in the grocery stores that we all need to get together and just stop. That is what's causing the supply chain problem. I spent some time this weekend in the new H-E-B Grocery Company's mega warehouse. It's 1.6 million square feet with 60-foot tall ceilings. It is rack to rack and wall to wall full of stuff. The problem that they're having is getting the groceries out of there onto the shelf because they're coming off so fast. We want a prepared community, not a panicked community. And I want to settle this down some, because the things that we do to prepare for floods, fires, tornadoes, hurricanes, and terrorism is the same thing we can do to prepare for this. The difference will be this social isolation and the distancing that we need to do. And most of us are not used to staying home and not getting out and not being social. So that's the piece that I think is new and unique for us. And if we can all work through that, I think this will be over in a relatively short time period.
Let's hope and pray that happens. Let's turn it over to Wes. He's been getting questions on social media.
Yeah, this first question will start from Arthur Gonzalez of Austin. You know, we talked about churches and other things, you know, other things like that. What are the rules for funeral services? Are those going to be on hold, or are funerals exempt from that 10-person rule?
The funerals, the governor actually addressed this question earlier, Arthur, but I'm glad he asked it again because it's important. Having a loss in your family and loved ones, it's important that we're able to celebrate those lives. They are effectually, you could say, exempt from the 10-person rule, but we are asking people to try and abide by that. Funerals are being allowed right now. Of course, we don't want to eliminate that opportunity, and not to be a broken record, but what we keep going back to is that as much as we can comply with the social distancing and with these CDC requirements, the sooner we can get to a more normal life. And quite frankly, we can provide the opportunity that in the loss of a loved one, people don't have to make these very hard decisions on how to have that celebration of life. So we've got to comply to be supportive of our entire community in our state.
The governor allowed local entities to postpone the May 2nd elections, and now folks want the state to let all Texans vote by mail. Right now, only certain people can get mail-in ballots. They're limited to the elderly, disabled, or folks who are away from home, their home county during the election period, like active duty military members on deployment. Eligible voters who are in jail can also get their mail-in ballots. Speaker, would you be open to allowing all Texans to have access to voting by mail?
I don't have a problem if folks want to vote by mail, but I don't believe we should be holding elections purely by mail. I think the reality of it is, in these circumstances, the other concept that people are not thinking about on election dates is that it's not simply the method by which we can exercise our democracy and cast our ballot. In elections, it's about discussing ideas and who the candidates are and what they stand for and what they believe. I wouldn't dare want to be campaigning for office today. I wouldn't dare want to be out there saying, vote for me for these reasons and why you don't want to vote for the other person. We really need to push the elections to a date that hopefully we can be beyond this health crisis so that candidates can go out and have a sharing and debating and discussion of ideas and then have that election in a normalized process, because it's not simply about ensuring the ability for people to vote, but we also need to have democracy. Is not just voting, it's debating the ideas and the issues and understanding the candidate's position. So I think we need to push those elections to a point where Texans have the opportunity to hear from the candidates and not in such an awkward position where I don't think anyone should be fundraising or campaigning anytime soon.
Difficult time for that. Wes, another question.
Yeah, let's talk with this question came from Twitter. This person said, I'm grateful to still have my job as a grocery cashier, but I'm a healthy man in my 30s and I'm worried I might be spreading COVID-19 without showing any symptoms. When can we expect free and widely available COVID testing? And we heard the governor touch on that a little bit in the live broadcast, but I think the key point there is that when can we expect that widely available COVID testing?
Did he mention where he is in a general area?
Did not get a general area on that.
Because in our more urban, and Nim, you might be better answers, but in our more urban areas, there is solutions coming soon.
See, and I think here may be some of the misconception about the testing itself.
Yeah.
The testing is only going to show if you have the signs and symptoms right now. If he is staying healthy, if he's washing his hands, if he's being careful about touching his eyes and his nose and his mouth, and that he's not around people that are sick, he's not running a fever, he is normally healthy, then he really doesn't need to fear spreading it. Constantly washing the hands, cleaning the surfaces around you are what we need to do in order to slow or stop the spread of this. I'm afraid that people think if they get the test, they're going to find out that they're not pregnant. Frankly, it doesn't work that way. You're only going to show positive on the test if you are actively shedding the virus load. It's not like I can test and be done and I don't have it from now on. So even the day after he took the test, he would still need to be doing the same things we're encouraging him to do before taking the test in order to stay healthy.
It's tornado season in Texas, severe weather, a big factor all the time during this time of year. A lot of distractions going on for our state leaders. Are we prepared for any natural disaster that hits?
I say absolutely. I mean, our first responders are the greatest in the nation. They're still out there on the front line. And the thing that we need to keep working on is a prepared community. Our police, fire, and EMS, doctors and nurses train constantly for all hazards and all events. You know, we do have quite a few natural hazard events here in this state. We talked earlier about most people don't understand what it takes to get a major disaster declaration, but it's actually based on dollars lost. Those dollars lost are based on population. So our state has the second highest population in the nation in order to be eligible for a presidential disaster declaration, yet we have more than every other state. So we have to stay focused on all of the things that go wrong. We talked earlier about scammers. People are not going to stop doing bad things because of the coronavirus. All of those things we still have to pay attention to. The things that we're asking people to do are really to limit this spread, and it's the things that don't feel like they're really taking action, but it's the things that we must do. The washing your hands, the covering your cough, trying everything you can to not spread this, and as of today, following the governor's executive order for how we close the things that need to be closed and maintain safe distances from each other.
Very quickly, on crime, do you all foresee a reduction in crime because everyone's home protecting their property, or fewer people out? What are forecasting crime statistics?
I think it's too soon to tell from my perspective,
Yeah,
Speaker.
I think it's too soon to tell, but I do, not to sound foolhardy here, I do hope those would understand that we're in a time where if you cared about your fellow citizens, this is as much a time to care about them, and it's not a time to take advantage of anybody. And so I would hope, not again to be naive, I would hope that crime statistics would go down during this time, because if there was ever a higher level of compassion for your citizen, it needs to be today.
Wes, you got a question?
Yeah, this question came from somebody in Austin. Would the state consider eliminating all charges and fees for toll roads during this state of emergency, and adding that this might help delivery drivers get to more people and help maybe minimize the cost for delivery?
I think Governor Abbott made the comment earlier when multiple options of different things on different issues were addressed. I was very proud, and I hope Texans are proud. Governor Abbott said, we'll consider anything. The governor has shown great leadership in saying, I will not eliminate anything from consideration. We need to consider all things. So the reality of it is, if that became an issue that would better help Texas respond and get us through this quicker, I think it's something that we would absolutely be willing to talk about.
Nim, the last time we had a public health disaster in Texas was in 1901. What happened back then?
I wasn't born.
Googled it, maybe? Maybe
Yeah,
I should Google it.
It was very similar to the influenza outbreak. And a lot of things were obviously different back then. One was modes of transportation, and I think that helped slow some of the spread, even though it was a very dramatic increase. But the things that we have now, the technology, the medical devices, all of the ability to treat patients better through advanced care and ventilators and ICU treatment, that also is going to give us a little bit different outcome. One of the challenges that we still have, as Dr. Hellerstadt spoke about earlier, is there's no vaccine for this, and besides, caring for the signs and symptoms that you're exhibiting, whether it's not getting enough oxygen in your blood because you have pneumonia, or not physically being able to breathe and have to be on a ventilator, those supportive measures out there is what we didn't have back in the 1900s that we do have today to help better your odds for recovery. We're a lot more populated than we were. We're a lot more dense than we were back in the 1900s. And so I think the thing that we really want to keep pushing the message on is pay attention to your local elected and public health officials today, because they're giving you the best advice. I've not yet met one public health physician that says this is not the right thing to do.
And just looking back on the optimistic side, they got through it back then. We're going to get through this, right?
Yes, sir.
Good. Absolutely.
All right, let's do another question here from social media. This is a Twitter question. This came from Ashley on Twitter. Ashley is asking, with Texas holding the second highest student loan debt in the nation, many Texans now unable to pay their student loans amidst job loss, how will you support student loan borrowers, Speaker?
I think that's a little bit more probably a federal issue, and it is an issue that I know is being discussed in Washington. I've got to give the federal government credit. They are making an immense effort with billions up to almost maybe $1 trillion package that they're working on. Governor Abbott is in constant communication with the White House and with the cabinet members, and so that is an issue that is being discussed in Washington and being looked at. With that said, there hopefully won't be a major crisis for those paying student loan debt if we can do CDC guidelines, we can do social distancing. The reality of it is the attitude of Texans should be how to abide by these guidelines and the emergency orders as best as we can to be done as soon as we can. And that will alleviate as many of these financial pressures as possible. We've only been in this for really 2 weeks from a public standpoint. If we can do our jobs and we can make a little self-sacrifice and do what we're good at, which is taking care of each other and helping each other and being considerate of our neighbor, we can get through this sooner rather than later. And so that will solve student debt being repaid more than anything, is keeping the job. Let's not lose the job. Let's keep the job, and if maybe there's a loss of job, it's brief, it's short, and we recover quickly and we get those jobs back. That is the best solution for our Texas citizens and for, frankly, these students who need to pay back, or more recently used to be a student paying back that debt. With that said, I know that it is a part of the discussion in the aid packages that are being talked about and will be passed soon in Washington.
We'll turn back to another question on Facebook here. Somebody asking, truck drivers, very important to provide food and resources for us, but not necessarily able to fit through the drive-thru. How can they get food as they drive across the country?
It's a great question. Now I want to be clear. As I understand it, the order today, they would still be allowed to go basically do order in and carry out. Sure. So it's not purely limited, I don't want misinformation, it's not simply limited to a drive-through. It's really just eliminating dine in. So they would be allowed, I'm correct, Chief Kidd, they would be allowed to place that order and then pick it up from walking in and walking out.
And Wes, I really don't want to oversimplify it, but I've walked up to a drive-through window before.
Right. We've seen people riding horses through the drive-through.
Yes,
That's right.
I guess there are some ways to get
Yes,
it.
sir.
Well, there's some pickup trucks that don't fit really well, and we are in Texas, so that's a real issue.
It is. Well, we want to ask you, Speaker, today we saw that the Texas Restaurant Association calling for the state to defer all sales taxes for their industry. Right. The governor said he's considering anything at this point. Would you support something like that moving forward?
I'm willing to consider anything, as the governor said, but I would point out on the sales tax, that is a tax that restaurants collect as sell. It's not a tax they're paying, it's a tax they're remitting, have collected it from all of us Texas patrons of their businesses. We pay that when we make the purchase, and they're simply remitting that tax to the state. And one thing that has to be understood about sales tax, that is revenues that come into the state that actually help stand up and support our emergency services and our health services and those type things. So we need to be very careful that we don't deprive the state of the resources to continue this relief effort and this support effort that we have. And I want to be very clear so no one's confused on what I'm saying here. It is not a tax the restaurant pays from its profit. It is them collecting the tax from you and I when we make the purchase and buy the plate of enchilada or what have you, and then they remit it to the state. I think what would need to be considered for restaurants is an actual tax that reduces their income in this very difficult time. The sales tax is not reducing of their income, they're simply remitting it, having collected it from all of us.
Well, what about the bars that are completely shut down?
The bars are in a real position, and so whatever we can do to help them, and again, I'm not saying we won't help on sales tax, I'm simply wanting people to understand that's not something they're having to pay out of their pocket. They're collecting that and are simply just supposed to remit it on to the state. We need to figure out a way to help the bars and the restaurants. It's part of what the federal government is doing now in these relief packages, is how to support these businesses across the country, not just in Texas, that are being hurt, not just by executive orders and those type things, but quite candidly, without an executive order, our restaurants were barely full to start with because people were acknowledging the heeds of social distancing and those type things. So it's not just businesses that are being affected by direct orders. There are businesses across the state that are feeling the pain of this by the social distancing and the things we have to do to get to a quicker recovery. But look, we want every business in Texas to be successful, and whatever we have to do to support them in doing so, when they're paying a price to support the recovery, we're going to help them.
Nim Kidd, something being asked a lot on Twitter tonight. Why are they not enforcing the 10 people rule in grocery stores?
I think the social distancing there and the commodities that are needed. We do see some stores that are limiting the number of people that are going in. For instance, my HEB wouldn't let more than 20 or 25 in at a time during the early stages, and this was even before today's executive order. So I think we are seeing that in some places. I know the grocery chain still needs to stay open, and we still want that. I know that they're closing after hours to restock and do constant cleaning. And so I think the reason for that is to keep that social distance out there, yet still provide the critical needs of food.
Okay. Wes?
Yeah, let's go to Jordan on Twitter, who is asking about, I guess, hearing the conversation about college students and wanting to know, won't we be able to get refunds because of closures and cancellations? Surely on a lot of people's minds talking about some of those repayments.
Well, I think the question there would be probably university by university, how they choose to go about that. But again, I know it's not easy what I'm about to ask, but we're on the front edge in trying to work through this crisis and have as little lengthening of it as possible. Those are great questions. Those are the things I'd be concerned about as a student, but those aren't answers we have today, because the reality of it is folks are dealing with what is in front of them today. With that said, our universities are doing their best to ensure that they do distance learning, online learning, what have you, so that they get the value of that education for the semester. I would assume that if they lose that semester, they would consider doing refunds. But their goal right now is to make sure they don't lose that semester, to make sure that they get that education that they paid for at the beginning of the semester, not only so they get what they paid for, but that they can continue to progress academically and not lose a semester out of their lives that holds them back in getting into that career they're chasing.
We'll turn now to this question from Dee Dee on Twitter. Dee Dee is asking, are the utility companies going to lower rates to help those without a job or unemployment or income of any kind?
That was actually a piece, not having the utility companies actually lower rates, but that was a piece of the legislation being discussed in Washington, D.C., is talking about assistance in paying utility bills and those things for those who may lose a job or on government assistance to begin with. So that's something that I would communicate with congressional leaders. I know the governor's discussing those issues with the White House and congressional leaders every single day. As state leaders, we have those conversations also, but I would encourage our constituents to talk to their congressional leaders also in regards to that. We don't have the ability to force a utility necessarily to lower their rates, but it is something that is being discussed in the federal aid packages that are being considered in Washington.
What are the nature of those conversations, whether it's state officials talking to federal officials or state officials talking to local officials, sure, or even just among state lawmakers? What's the nature of those conversations?
It's a great question, and it's one thing that I want Texans to take very positive perspective of. They're positive. You're having Republicans and Democrats have conversations, and they're being had in the most respectful and civil possible way. What you're seeing in our country and in our state today is people coming together to not argue, to not fight, to not be partisan, but to solve problems for people that are in a tough situation. And so those conversations are based on what are the best and quickest ways to provide relief to people who are in a tough situation. And I really hope, for whatever it's worth, when we are asking people to make sacrifices, candidly, we're doing our best to respect each other to get to a quick result to help support Texans that need it.
A lot of lawmakers in that chamber. How do you cut through the politics and make sure that it is the business of the people?
Well, because what I've always said is every person who seeks public office does it because at somewhere, some point in their life, and even carrying through, they have a desire to help people. We're public servants. No one puts their name on a ballot to come to Austin or Washington to not be a true servant of the public. Now, we may have a different philosophy on what that means and what the best way to serve or support or what the right policy is, but every one of us has a passion to help people. And this is the time when people need to be supported and led and helped more than ever. And so we're able to recognize when you put these political fights away and you go to work for the people. And you may have a difference of how to help them the best, but you don't let those differences stop you from a success point to deliver support as soon as possible.
Okay, we've got another question about the elderly. They're being asked to stay home, but they need supplies like everybody else. Would it be possible to give seniors some help on their shopping?
So I think we've heard that some of the grocery chains are letting seniors come in a little early. I know there's several Meals on Wheels programs that are out there to do that. If our local, if citizens need help and contact their local Office of Emergency Management or their local officials, we will find additional resources across the state, whether it's through volunteer organizations or even employment of the Texas Military Department if we had to in those cases, to help make sure that food goes to the elderly and that nobody goes without.
And Robert, real quick, if you don't mind, this isn't the solution, I want to be clear, but I want to talk about this because this is what makes Texas and America great. I saw a story the other night where a young girl, teenage girl, who's obviously home from school, has now gathered her friends together, is using technology because she wanted to make sure that for the exact issue of seniors who are being asked not to get out, they are now helping seniors by going and buying their groceries and taking it to their door. So there isn't, you know, the best thing about Texas is we don't always just wait for the emergency management chief and government solution. And what a heartening story that at this time, you know, a young high school student in Texas says, no one tells her to, no one directs her to, I'm going to go help solve a problem for senior citizens because I see the need.
Sandy on Twitter asks, should we be worried about a gasoline shortage?
No.
No.
We got a lot of gas out there.
We do.
Ready to be sold.
The fight between the Russians and the Saudis is over. They're wanting to hold back the gas because they want to drive the price down to fight each other. There's plenty.
How low could we see the prices go?
I would be irresponsible to guess at something I know little about.
Okay.
It's fearful to see how low it may go, but I think that's unknown at this time.
All right. Now a question from Jeff McCormick on Twitter. He says, I have several friends that are constantly downplaying the severity of the COVID-19 outbreak, saying that the virus is little more than media hype. What can we say to people that refuse to listen to these advisories?
You know, I feel sorry for those folks. We wouldn't be sitting here if this was just media hype. We've got plenty of great work to be doing out there. I think sometimes it's a little hard to see. We still have people that won't trust a weather forecast, that won't watch a Category 1, 2, 3, or 4 hurricane come in, won't evacuate whenever we've asked them to do. And that's with something that's scientifically proven in the rainfalls. We have people that don't evacuate from wildfire even though they can see the smoke. This is a little harder for some people to wrap their head around because they can't see it. It's not some other element that's trying to attack us. In some cases, it's us that will be getting each other sick. So I would say to those that believe it's a bunch of hype, that it's not true. I would not ask them to travel to where it's happened because that would be very irresponsible. But they need to listen to their public health authorities. If this was not true, we wouldn't be wasting our time here having these conversations, but it's so important to get this message out right now.
And on that note, I don't know how we can convince them otherwise, but what I would want to convince them of, the sooner we comply with CDC guidelines and these executive orders, the sooner what they think maybe isn't true will go away. And so if they don't like what's going on, which none of us really do, the sooner we comply, the sooner we can get back to normal. And that's what I would ask of them. I mean, Chief Kidd is dead on, but whether you agree or disagree, comply and let's be done.
Good advice.
This question comes from our live feed here. Of course, the tax returns and getting people's taxes in, I know that's a federal issue, but have you had any conversations with anyone at the federal level about, you know, how they are going to get their taxes
I believe
sent in?
I don't want to give absolute information because I don't want to give bad information. The most important thing in a situation like this is you don't give misinformation. Right. But the feds have already extended the deadline for income tax. I forget to what date they pushed it to, so I don't want to say, but I know they have already extended it out. The president has done that.
Very good.
So there is relief there.
Yeah.
Let's talk about, we've heard reports that people are going to buy guns because they fear maybe civil disobedience will get worse. What's your advice on that, Jim?
You know, it's a tough question. I'm a gun lover. I've grown up with guns all my life. I would never discourage the buying or keeping of firearms. I would tell people, please don't panic buy, regardless of what the commodity is. The panic buying right now is just causing disruptions to the chain, and it's not necessarily needed.
We saw businesses on 6th Street in Austin boarding up. That's our entertainment district here. What's your reaction to that?
It's heartbreaking.
And it goes back to the question earlier. No one wants that. I mean,
do you think it's necessary?
I do.
You do think it's necessary?
Right now.
And to that end, I mean, that's the point earlier. And who would believe the President of the United States in an election year would want the economy to be put in such a dire position for no good reason? It's ridiculous to think such a thing. So it's against his interest for this to be going on. No governor of any state wants to be dealing with what they're doing. Governor Abbott, I told him on the way out, I said, get some rest. Governor Abbott has been leading from the front. He has traveled all over our state. He has been putting his heart, soul, and every day into this. No one would choose this for the joys of it. This is real, and people need to respond accordingly. And the sooner we follow these guidelines, the sooner we do our part, the sooner we can pull the boards off the entertainment district on 6th Street and go back to normal. But if we pretend this isn't happening, it will continue.
So you think it's necessary. Why? Why do that? That seems extreme, like a hurricane's coming, we're going to board everything up.
There is a storm coming. It's the coronavirus. We're watching it. If you've watched any of the maps out there, as we've seen it start off in the Wuhan and travel across China, travel across Asia, now here in the United States, starting on the borders and closing in. It's here. You just can't see it like you can the normal disasters that we take. And I think, that unfortunately, again, it breaks my heart that we're in this place right now. But these are the only steps that we can take in order to do anything proactive to try to limit or slow this spread.
Nim Kidd, head of the Texas Division of Emergency Management, and Dennis Bonnen, the Speaker of the Texas House. Thank you both for coming in. It's been a very enlightening and sobering evening to hear all what's going on, but we all hope that we can get through this very quickly and be on the other side very soon.
Thank you to Next Star, and thank you all for doing this.
Thank you very much.
Thank you all.
Thanks a lot.
Good night, everyone.
Will Dupree, once again here in Austin, broadcasting after this town hall has now completed with our live stream and our televised version that went all across the state of Texas. We do appreciate you all sticking with us throughout this as we've continued to follow information, then pass it along. What I'll say is that we have, as a company, stations all across the state who are doing their level best to not only gather all of the information that is coming in like an avalanche at this point and is changing constantly. We are taking that in, processing it, writing it up, sharing it, and then putting it out there so that you all can understand it in the best way possible. Please keep doing that throughout the rest of this time, because that's all we can do right now. We are trying to do our best to share everything. That's why we had this town hall, so that you all could ask questions of the officials. We understand we can't get to every single question and concern. We have many that we couldn't address at this point, so those will still be left to be answered at another time. Before we end our live stream, I just want to say thanks again for watching, but if you want to take a look really quickly, we did get some updated numbers, and unfortunately the case numbers are going up here in Texas. Take a look. There are now 309 confirmed cases of COVID-19 in Texas, 5 deaths now in Matagorda, Collin, Tarrant, Dallas, and Harris counties. And now more than 2,300 people have been tested for COVID-19 here in Texas. Once again, I'm Will Dupree, broadcasting to you all here in Austin. We thank you all for watching. Please stay closely watching all the reporting that's being done by your local news media, because we are trying our best to keep you informed and safe as well. Thanks again for watching. Enjoy the rest of your night. Please be safe.